Now, you know there are two types of diabetes. Now, the more common ones are type 2. In type 2, 90% of the cases, it is that the body is able to produce enough insulin. It's just that the receptors or the key for the insulin on the cells don't function very well. As a result, the cells do not let the insulin bind properly, and as a result, the glucose doesn't move to the cells very well. People have postulated many causes for why this happens. Some people think it's an infection, like an antibody effect that blocks the receptors for insulin. Some people think that it is programmed that these cells fail. But we do know that there is a genetic cause that can be seen, as in people whose family members, especially parents, have diabetes. They are also at high risk of developing type 2 diabetes later on in life. Okay. For type 1 diabetes, it's a bit different. It has nothing to do with the receptors on the cells. It's just that the pancreas doesn't produce enough insulin. And a lot of these cases start younger. They are usually, some may be congenital, some happen in teenage years. Some people postulate, again, it's antibody or infection mediated, and it causes the pancreas to fail. Whereas for type 2, it usually comes on later in adult life. Used to be that we used to see patients in 50s, 60s, or 70s developing type 2, but increasingly we see some patients in their 30s developing type 2 diabetes. And this is a subject of a lot of research. There's another condition of diabetes that is gestational diabetes. There is women who develop diabetes during their pregnancy. Now, they get very high glucose levels. They're like diabetic during pregnancy. Most will recover after the pregnancy is over, but having gestational diabetes makes you at higher risk of developing type 2 diabetes in future.